Question 1. A patient with second and third degree burns on both legs received an initial treatment of topical antimicrobial agents. Then the legs were wrapped with sterile dressings. On performing a routine assessment, the nurse finds pedal pulses are diminished. What is the first action for the nurse? A. Loosen the dressings. Because edema is a common complication with burns, the patient should already have both legs elevated on pillows, with routine checks, including peripheral pulses, every 2 hours. Peripheral pulses are the posterior tibial, ankle, and dorsalis pedis, foot. If pulses are diminished, the first step is to loosen the dressings and recheck the pulses to determine whether the dressings were wrapped too tightly. Question 2. A 13-year-old has just started to menstruate. Which statement should the nurse make during client education? A. You can take a mild analgesic if you get cramps. Taking a mild analgesic such as ibuprofen is appropriate to relieve any discomfort. The temperature of food has no effect on menstruation. Exercise should be continued. Tampons may be used as soon as the adolescent feels comfortable inserting them. Slender tampons may be easier to wear because they are smaller. Question 3. The mother of an adolescent boy with celiac disease phones the clinic to report that her son is experiencing severe diarrhea and cramping after having eaten pizza the evening before. He told me he doesn't want to be different from his friends, she tells the nurse. The nurse knows the main issue is C. Low self-esteem. Adolescents feel secure when they can be like their friends. They tend to adopt the same behaviors and attitudes. The management of celiac disease requires constant attention to a gluten-free diet, so the teen feels different when he is unable to eat the same foods as his peers. He may develop low self-esteem or depression because of social difficulties or stigma. Question 4. After their 12-year-old daughter is prescribed a brace for her scoliosis, the nurse provides instruction to the parents. Which statement by the mother indicates a need for more education? C. I'll put lotion on her skin before she puts on the brace. Lotions, creams, and powders can soften the skin, making it more susceptible to breakdown. The t-shirt and brace should fit snugly to avoid rubbing and irritating the skin. The girl can stay active and perform specific exercises recommended by a physical therapist. Question 5. The football coach invites the school nurse to instruct the team on proper hydration during hot weather. The nurse teaches the athletes to avoid dehydration by C. Taking a fluid break every 30 minutes during practice. The combination of physical activity and hot weather accelerates dehydration. The body needs regular water and electrolyte replenishment, so a short break every 30 minutes is recommended. Drinking fluids before and after practice is a good idea, but this will not maintain water and electrolyte balance during strenuous activity. Salt tablets may not be administered without written approval from each athlete's healthcare provider. Question 6. When a nurse interviews the parents of a 15-year-old girl diagnosed with anorexia nervosa, the parents tell the nurse they don't understand why their daughter refuses to eat. They state that she has always been so compliant and eager to please them. Which relationship style describes this family? A. Enmeshment. Enmeshment occurs when personal boundaries become unclear. In enmeshed families, children are raised to follow the parents' expectations in all life areas rather than become independent individuals. A child who must follow strict family rules can develop anorexia nervosa to control the one area that parents can't control, eating behavior. Question 7. A mother calls the pediatric clinic to report that her 3-year-old child has diarrhea. She asks how to manage it at home. What should the nurse suggest? B. Continue the child's usual diet as tolerated. The American Academy of Pediatrics recommends continuing the child's usual diet to maintain the electrolytes and complex carbohydrates found in a balanced diet. The other options, including the popular brat diet, bananas, rice, applesauce, and toast, are lower in electrolytes. The nurse should also ask the mother to describe the diarrhea in terms of frequency and appearance, to determine what the mother means by diarrhea. Question 8. After assessing their speech development, which of the following children should the nurse refer for further evaluation? A. An 18-month-old boy who only says no. By 18 months, a child should be able to say several words. The child should also be pointing at objects they want or at pictures in books. Lack of speech development can indicate a lack of social stimulation, a hearing deficiency, or a developmental delay. When a child seems to be lagging in language and cognitive development, further evaluation is recommended. Question 9. During a routine checkup of a 2-year-old boy, which option indicates a developmental delay? B. He can only say mama and dada. Most 2-year-olds have a vocabulary of about 50 words and are able to combine 2 words to make a simple sentence. Drinking from a glass occurs about age 2. Drawing depends on a child's fine motor skills. Toilet training can start between ages 2 and 3. Question 10. While helping a new mother with breastfeeding, the nurse observes something unusual in the neonate. Then the nurse reviews the mother's history and notes occasional use of alcohol during pregnancy. Which observation would indicate that the alcohol use was more frequent? C. The neonate is shaking and irritable. Fetal alcohol spectrum disorder, FASD, is a range of conditions related to maternal alcohol use during pregnancy. Neonates display signs of withdrawal, including irritability, shaking, and high-pitched crying. As they grow, these children may have developmental disorders related to hyperactivity. The other answer options are not related to FASD. Question 11. A 16-year-old confides in the school nurse that her father is an alcoholic. The nurse knows that growing up in an alcoholic family can affect this teenager in which way? A. She is likely to develop low self-esteem. Children who are raised in an alcoholic household can develop low self-esteem. They can also have trust issues and the need to control, and they may become overly responsible. These attributes are often carried into adulthood. The other answer options are not commonly associated with growing up with alcoholism. Question 12. A nurse is teaching parents how to administer ear drops to their 18-month-old daughter, who has otitis media. Which instruction is correct? B. Pull her earlobe down and back before instilling the drops. For children who are under 3 years of age, gently pull the earlobe down and back before instilling the drops. For children over 3 years of age, gently pull the ear up and back first. Ear drops are usually stored at room temperature. If not, warm them to room temperature to prevent the child from feeling dizzy or nauseated. Hand washing is sufficient before and after instilling the drops. Question 13. An hour after the vaginal birth of a term neonate weighing 10 pounds 8 ounces, 4,763 gm, which of the following should the nurse monitor closely? B. Hypoglycemia. A neonate weighing more than 4,000 g is considered large for gestational age, LGA, and at risk for hypoglycemia, caused by the rapid depletion of glycogen stores. Hyperbilirubinemia may develop if bruising occurred during delivery, but it will not be apparent at 1 hour post-birth. Question 14. A 9-year-old girl with a diagnosis of attention deficit hyperactivity disorder, ADHD, is starting on methylphenidate, Ritalin. What will the pediatric nurse assess during follow-up appointments? A. Height and weight. A possible adverse effect of stimulants such as Ritalin, Adderall, and Concerta is the slowing of growth. A 2013 study found that by adulthood, most ADHD children who had received such medications had achieved normal height. However, growth is still monitored during medication therapy. Question 15. A nurse is working with parents whose newborn daughter has a congenital birth defect. Which psychosocial need for their child is most important for the parents to understand now? B. Trust. According to Erickson, all infants from birth to 18 months must learn to feel secure in the world. When parents provide consistent care and stability, the baby learns to trust relationships. Regardless of this baby's medical situation, the need is the same. The other answer options are incorrect. Question 16. When a child offers information that indicates possible sexual abuse, what is the nurse's best initial action? B. Assure the child that you believe them. Sexual abuse can be very difficult for a child to disclose. When discussing sexual abuse, the best initial response is to accept that the child is being truthful. Following the disclosure, the other nursing actions are appropriate. Question 17. A 17-year-old girl has been transported to the emergency department by EMS after she was in a motor vehicle accident. She starts to sob inconsolably, telling the nurse, "I just got my license, and I wrecked the car. My parents are going to kill me." Which should be the nurse's first action? A. Sit at eye level and tell her, "It's scary. Just take some deep breaths." When a client is in a crisis situation, Start by helping the client to decrease anxiety. Give simple directions that are helpful. Focus on the client. Use therapeutic touch if appropriate. The other answer options do not address the client's anxiety, and they may not be true statements. Question 18. The nurse is caring for a 3-month-old infant with infectious gastroenteritis. The infant is lethargic, and the mucous membranes are dry. Which other finding indicates moderate dehydration? B. Sunken fontanelle. A sunken fontanelle is a sign of increasing dehydration. It is first noticed when dehydration progresses from mild to moderate. Mild dehydration may be evidenced by increased thirst and decreased urine output. Anuria, no urine output, is a sign of severe dehydration. Question 19. During a routine checkup of her 2-year-old son, the mother tells the nurse proudly, "He loves to drink milk. I give him as much as he wants." The nurse should counsel the mother and tell her that more than 3.5 cups of milk per day can lead to B. Iron deficiency. Eating or drinking in excess of any food can lead to a nutritional deficiency because the diet becomes unbalanced. If this child drinks too much milk, he won't be as hungry for other foods, and he won't be exposed to a variety of tastes. Dietary iron aids early brain development. An iron deficiency can permanently affect psychomotor development. Question 20. When a mother enters the playroom of the pediatrics unit to visit her 3-year-old son, he does not immediately go to her. What is the reason for his behavior? B. The child is displaying normal behavior. When young children are separated from their parents, the phases they go through include protest, despair, and denial or detachment. In the stage of protest, when the parents return, the child readily goes to them. In the despair stage, the child may not readily approach them, or may cling to a parent. In denial or detachment, when the parents return, the child is cheerful and interested in the environment and new people. The child may even be unaware of the parents, while being friendly toward the staff. Question 21. A 7-year-old girl with a diagnosis of leukemia is admitted for treatment. She asks the nurse, "Am I going to die?" What is the nurse's best response? D. How are you feeling today? Tell me what you're thinking. Regardless of a patient's age, always give the patient an opportunity to talk and tell you what they are thinking. Being in a strange setting or undergoing a difficult treatment can make any client anxious. Therapeutic communication is essential. Question 22. A 3-month-old African American male is being assessed during his routine checkup. The nurse notes a dark blue pigmented mark across his back and buttocks. What should the nurse do? D. Document the observation in the infant's record. Dark-skinned infants, African, Asian, Indian, and Mediterranean descent, often have Mongolian spots, which are flat, dark blue or blue-gray, and irregularly shaped. They can occur anywhere on the body but most often on the back or buttocks. They can be small or large. They usually fade by age 5 or 6. Question 23. A mother brings her 5-year-old daughter to the pediatric clinic because the girl has recently started to wet her bed. On questioning the mother, the nurse learns that the mother recently gave birth to a second daughter. The nurse explains to the mother that her older daughter is using which defense mechanism to cope. D. Regression. Regression is returning to a behavior from an earlier time in life. The daughter may be seeking the same attention that is being shown to the baby. Identification occurs by copying the behavior of someone else. Repression is blocking a desire from the conscious mind. Projection is the unconscious placement of one's own negative traits or feelings onto someone else. Question 24. A pediatric nurse is caring for a 9-year-old girl with a known history of having been abused. Which therapeutic action should the nurse include in the child's care plan? D. Ensure that the care setting allows the child to redevelop trust. An abused child will require long-term support and therapy, starting with an environment of safety, security, and empathy. The nurse can model appropriate behavior while giving care. Question 25. The parents of a 16-year-old girl with celiac disease bring their daughter to the clinic because she is having constant, watery diarrhea. The girl tells the nurse that she ate pizza and a hamburger on a bun at a party the night before. She says, "I want to be like my friends. They can eat anything." When responding to the teenager, which problem should the nurse prioritize? D. Low self-esteem. The teenager tells the nurse that she ate food with gluten because she wants to be like her friends. The nurse can listen and discuss possible ways to have fun without eating gluten and becoming ill. Although there is evidence that she has constant, watery diarrhea, there is no indication of an electrolyte imbalance, intestinal damage, or feelings of self-harm.